Hey there, this is Cassie. Thank you for reading my blog. I appreciate it. I hope you can follow my random trains of thought. As I was writing this particular blog, I was realizing that it might make a lot more sense, particularly in discussing the bilateral stimuli, if I actually explained it verbally and showed you a little bit. So, the original research on EMDR was completed using eye movements. What that means is your clinician would sit to the side of you and you would follow their fingers going back and forth without moving your head. So you're going to keep your head stationary and you would follow their fingers. Now we could go fast depending on what we're going for, or we could go slow depending on what we're going for. So for me personally, especially if I'm doing a 90-minute session, I start sweating and I have to switch hands, and my left hand is not as good as my right hand. So I actually prefer using equipment. And there's different types of visual equipment, but for the most part, what's going to happen is there's going to be a light of some sort. It could be in a light bar or on some sort of screen. And that light will move back and forth, and you just are following that light with your eyes as you're allowing your mind to go wherever it needs to in the memory that you're working on. Some people don't do well with eye movements. I'm one of those people. Now, because the research was completed using eye movements, it is technically the preferred way to do EMDR, but if you are doing eye movements and you're not finding any change or any shift, then it's okay to try a different type of stimulation. Another stimulation is using buzzers. So you would hold these in your hand, in your lap, wherever's comfortable, and as you're noticing the memory that you're working on, the buzzers move back and forth. Again, they can be fast or slow depending on what specifically your clinician is trying to help you with. If someone doesn't have equipment, they can do tapping on your knees. I personally don't like touching my clients. As a psychologist, we're not supposed to touch people, especially if you're doing if you're processing memories related to sexual abuse. That could be really triggering to people. So I will use buzzers. Some clinicians, and I'm one of them, might actually use more than one at the same time. So they might have you following the light with your eyes and having buzzers in your hands. So it just really depends. There's also another type of stimuli, which is auditory. So you could have headphones and a sound would go back and forth. So it really depends on the person, what stimuli works best for them. And so it's important that you have an EMDR clinician or psychologist who is flexible with you, and you can try it in different ways and see what works the best for you. And as I think I had mentioned in my blog, there are also some new studies, reports coming out that it might not even necessarily be that you have to use any of these stimuli where it goes back and forth. The original belief was as you have a stimuli going back and forth, it's activating both hemispheres of the brain. We're starting to see that it might not necessarily require bilateral stimuli back and forth. It might just be anything that taxes your working memory as you are recalling the disturbing memory. So that is newer information, and we'll see where that goes. But as of now, the research is still more solid with the bilateral stimuli, preferably eye movements, but at times it may be more beneficial for you to do tactile or auditory or a combination, which I have found works for a lot of people. So thanks for tuning in.